everyone, and welcome to today's simulation experience. My name is Dr. Fogg, and I'll be your facilitator today. Before we begin, let's go around and have everyone introduce themselves with their name and one word describing how you're feeling about today's simulation.
Hi, my name is Emma. I'm feeling pretty excited about the simulation.
Hi, I'm Tanya. I'm a little nervous about the simulation.
Okay. We'll get into that a little more. Thank you for introducing yourself. Before we dive into our scenario, I want to take a moment to establish our learning environment. The simulation is designed to be a safe space for learning, and so we have a few important ground rules. We do expect you to make mistakes. You're a student and you're learning, and mistakes are expected and welcomed. They're learning opportunities for all of us. Everyone's input and valued. We like to learn from each other's perspectives, so if at any point you feel like you're not comfortable and you're not being heard, let us know and we can discuss it. What happens here stays here, so confidentiality is paramount. We want to give you the opportunity to learn and to feel safe in that environment and know that anything that you feel is a mistake is not going to be shown elsewhere. We want to respect each other and all of our participants and support each other's learning journey, and know that this is a no judgment zone. We focus on our systems and decision making, not personal criticism and then a growth mindset, because we want to improve our practice together. Does everybody feel comfortable with this?
Yes.
Is there anything we've missed or any questions, anything else we need to add?
No.
Okay. So we're going to go ahead and talk about our fiction contract. This means we're going to agree to play along with our simulation scenario, even though we know it's not real, right? This is a simulation mannequin in the bed, but we're going to treat this mannequin as if it's a real patient. For today, this is going to be Susan Haggerty, who's a 41-year-old woman. And we're going to ask that you respond as you would in your actual clinical role. You can narrate your care as you go along so that we can all hear and understand your thought processes, but actually respond to the patient as you would in an actual scenario. Instead of saying, I would do this or I would say this, speak to the mannequin as if you were speaking with an actual patient. Tell them what you're going to do and walk through what you're doing. Engage with the scenario as if it's happening in real time using real clinical decision-making processes. We do have to also accept the limits of the simulations, as some things may not be perfectly realistic depending on our environment, and that's okay. If at any point something doesn't seem realistic or you're confused or have a question about that and feel like that is impeding the scenario, we can pause and address it before we move on. And so we just ask that you suspend disbelief for that part and immerse yourself in the experience. Does everyone agree to this?
Yes.
So today's simulation focuses on a post-operative assessment and nursing management of that following laparoscopic cholecystectomy. So by the end of this experience, you should be able to perform an appropriate focused assessment on a post-op lap chole patient, prioritize care of a post-op lap chole patient, and initiate appropriate interventions for the care of a post-op lap chole patient. So now I'm going to go ahead and we'll set the scene for our scenario and give you a report and orientation to the scenario and the environment. So we're in an inpatient medical surgical unit in the patient's room with Susan Haggerty, the 41-year-old female. It's an afternoon shift and it is post-op day 1. She had an uncomplicated laparoscopic cholecystectomy today for cholelithiasis and cholecystitis. Susan received morphine, 2 milligrams IV for pain, about 30 minutes ago. She has not voided since surgery and is tearful and anxious. Her husband was with her in the postoperative recovery room, but is left to pick up their 3 children from school and will return. You have available to you physician orders, which are available for review, and standard medical surgical unit equipment. And our key focus areas are going to be our postoperative focused assessment, looking at pain and management of pain, anxiety intervention, infection prevention, and therapeutic communication. So now we will look at roles and responsibilities. So I'm going to clarify everybody's role for today and what that role entails. As we are working with 2 of y'all today, we will divide those roles up amongst you. Okay? So we have a primary nurse, and their job is to coordinate patient care, assure orders are followed and completed. The assessment nurse is responsible for completing a focused assessment and communicating findings to the team. The medication nurse, administering medications following the 6 rights, and assessing allergies. For our purposes, our rights are patient, med, dose, time, route, and documentation. We have our procedure nurse, which is completing procedures as ordered, and our recorder, recording for the team what has been done and assessment findings for later documentation. Even though we will split up and divide up into our roles, we are mutually supporting one another and are equally accountable and responsible for the care of the patient as a team. So we should always assist other team members when necessary and able, and are responsible for holding each other accountable, asking questions or speaking up if something doesn't seem right. If you see a team member go to do something and they're missing a step or they forgot something, gently speak up and help address that. For our environment, we're going to go ahead and orient y'all to our environment. So we have our patient monitors, which are reflecting the patient's vital signs in real time. So you don't have to take vital signs, you just need to confirm that they're accurate. Okay. We have our IV equipment and medications as ordered. So we have our Alaris pumps, which y'all have worked with in the past. And then we have other IV equipment and medications as ordered available to you. We have dressing change supplies available on the counter. And all of your documentation materials are there as well, with your iPads to access your EHR and your barcode scanners to administer medication. Charting will take place for all team members following the SIM, and then you have your call bell and other communication devices. Specific limitations or things, nuances specific to this environment will be, we have, with our documentation system, y'all will document on the board, the documentation nurse during the scenario, and then everyone will be able to take a screenshot or a snapshot of that to take with them out of the whole team. Each team member will get to individually document following the simulation in the electronic health record. Some equipment may be simulated or have limited functionality. All of our oxygen and suction, it works and functions with a compressor, but it does not deliver real oxygen, it's compressed air. So we would never want to use that with a real patient. Lab results will be provided verbally when requested. They will not be located in the EHR today, if applicable. Communication will be through the facilitator as the provider, so I will serve as your provider in this scenario. And you'll verbalize that you need to contact the provider and then speak to the provider as you would in real life using the SBAR method. These, with this simulator specifically, has a drain bag, so you can go ahead and you will see that the IV fluids are infusing through into their IV catheter. It is actually running through the mannequin. And just if you notice this back here, just know it's to help drain the fluids, and you don't have to worry about that. There are a few other lines or things like that, and if something becomes disconnected or you notice a change, just let us know. Okay? But you will be able to speak to this mannequin per usual and have them respond to you as well. You'll be able to hear their voice. Any other emergency protocols to consider? If you feel uncomfortable and there is an emergency or something that you need us to stop the scenario, simply say this is a real life emergency and we will understand it's time to pause and reflect. If you're confused about equipment, ask for additional clarification, and then we can provide other resources as necessary. Everything is connected with this via Bluetooth, and this is the one specific one that we're concerned about. If you'll notice right here, there's a little kind of button on the side, and you'll see little lights on it, and that is their connectivity and how they work. And so we just want to be careful as we roll and turn and move in the bed that if it looks loose or gets knocked off, that we get that reconnected. And so a few other points to remind you before we begin is to think out loud. We talked about sharing your clinical reasoning and talking through your processes so we can all learn and see where everybody's going with their scenario. Communicate with your team using SBAR or other structured communication. Focus on your patient safety. Remember your standard precautions and safety protocols. Remember your 6 rights with medication and administration. So our patient, dose, route, time, med, and documentation. And as always, we want to practice therapeutic communication with our patient. Are there any other questions about the scenario, objectives, or expectations? Okay. So we did go over roles delineation earlier, and so we're going to divide those roles up amongst y'all. We are going to go with primary nurse and assessment nurse. We will let you take those.
Okay.
And then we'll do procedure nurse and medication nurse with you. And as you do that, if you would make a note on the board.
Okay.
I feel like as she's assessing, if she'll narrate that, if you would document the assessment findings, and then we can switch out if we need to for recording. Okay. And so we are about ready to get started, and we are going to go ahead and give you a report on Miss Susan Haggerty as you move into the scenario. So I'll give you a couple minutes to gather your thoughts. So then we'll halt that, and then I'm going to give you a report, and then y'all will start your scenario. Okay? All right, and I can clip all this later. Okay, and I can go ahead and get. Are y'all ready to receive a report on Mrs. Haggerty?
Yes.
Okay. The time is 14:30. I'm the post-op nurse that's been caring for Mrs. Haggerty, who's 41 years old. She presented to the emergency room this morning with complaints of severe right upper quadrant pain and 3 days of nausea and vomiting. She has no previous relevant medical history. Ultrasound revealed cholelithiasis and cholecystitis. She underwent an uncomplicated laparoscopic cholecystectomy. She received morphine 2 milligrams IV for pain that was rated 8 out of 10 about 30 minutes ago. She has not voided since surgery. She's a little tearful and anxious. Her husband was with her in recovery, and then he had to leave to pick up their kids from school, but he should be back and bring them back with him later this afternoon. Her vital signs prior to transfer were heart rate 88, respiratory rate 20, blood pressure 137/76. She was able to take sips of water prior to coming up from the OR from post-op. And she has an IV of D5, 1/2 normal saline, infusing at 100 milliliters an hour. You'll have new post-operative orders that they should be loading for y'all soon. And her last antibiotic dose was during surgery about 6 hours ago, so she will be due for her next dose of clindamycin.
Hi, Mrs. Haggerty.
Hello.
My name is Tanya. I'm an RN who's going to be helping take care of you today.
My name's Emma. I'll be also taking care of you today.
So we understand that you are just coming out of a surgery. Is that correct?
Oh, yes.
Can you verify your name and date of birth for me?
Susan Haggerty, April 7th, 1984.
Okay.
Okay, thank you. Do you have any allergies that we need to be aware of?
No,
And other than at your incision sites, are you feeling any pain?
no, but my belly has hurt a lot.
Okay. Right now, what would you rate that pain at? 0 being no pain at all and 10 being the worst pain you've ever felt.
Gosh, it's probably about, I would say a 6.
A 6? Okay, so I understand that they gave you some morphine about 30 minutes ago, is that right?
Yes,
And do you feel like it helped your pain a little bit?
maybe a little bit.
Okay. Okay. I'll go ahead and look in your chart and see what pain meds that you have available. I believe you have some antibiotics that are going to be due soon. So I'll take a look at that, but we're just going to go ahead and just do a really quick assessment on you and see how you're doing so far, okay?
Okay,
Okay. Do you have any questions for me right now?
okay. No, I don't think so.
Okay.
Hand sanitizer.
Okay. Let me grab some gloves.
And I'll be documenting what you find.
Okay, so right now, I'm gonna go ahead and take a quick listen to your heart, okay, and your lungs.
Okay,
Right, nurse. You would have to listen for the sounds underneath the patient's clothes.
All right, I will do that. I'm gonna raise your shirt for a second so that I can listen to your heart and your lungs, okay? Are you okay with me lifting your shirt?
Yeah, that's fine.
Okay. Heart and lungs are good. Lungs are clear. Okay. Regular S1, S2. No extra sounds heard. No warmers present.
And then were
The lungs are equal.
Okay.
Equally clear bilaterally. Respiratory rate is normal. Okay. Okay, so the next thing I'm gonna do is I'm gonna take a quick look at the incision sites that you have. I'm gonna need to raise your shirt again. Are you okay with that?
Yes.
And then nurse, I'm just gonna lift the bed up a little bit to help with.
So this is your horizon right here.
Are we actually supposed to be scanning?
No, you're just supposed to say that. But then you're gonna hang this one, and you have to hang this to go IV piggyback to your Put that back on. Sorry.
Okay.
Okay. So. Okay. So her pain. Oh, that's what I was gonna say. Her pain has gone down. Her heart rate is still the same. She still doesn't have a temp, so we're good there. But her heart rate is okay.
Okay.
So, okay, Mrs. Haggerty, we're going to go ahead and get your antibiotics set up on the IV pump. But as of right now, the
Okay.
doctor is saying that we can't give you any more pain meds, okay?
Oh, God.
Okay, so what I'm gonna do is I'm gonna try to cut a little bit of the stimulation going on. So I'm gonna turn once we're done, I'm gonna go ahead and turn off the lights. And I'll teach you some deep breathing exercises and some visualization exercises to see if that can help with the pain.
Okay.
Okay, so Emma's gonna go ahead and get your antibiotics set up. And then I'll do the patient education with those visualizations and the deep breathing exercises to see if we can get that pain level a little lower, okay?
Okay.
Okay.
Do you think I could turn over on my side?
Do you want to turn to your right or to your left?
I think maybe on my left, on my left would be better.
Okay. So I'm going to see if I can find some pillows just to kind of help prop you up to take a little pressure off, okay?
Okay, thank you.
Okay.
And they match. So I'm gonna go ahead and scan this. Just gonna get ready to hang. antibiotic. Alright, Ms. Haggerty, can I just get your last name and full name and birthday, please?
Susan Haggerty. April 2nd, 1994.
Okay. Okay. So we have a right patient. Okay, just priming the line.
Don't forget to scan.
Okay.
Okay, the medication has been scanned. Milliliters per hour. That means there's 60. I don't think it's over 6 hours,
No.
so that wouldn't be right. Because that's the IV dosage right there.
Yeah.
Every 8 hours. So wouldn't that be over an hour?
30 minutes to an hour, depending on what the drug book says.
Well, it doesn't. It
Right,
doesn't give
it's
us
not
a-
going to necessarily say in the order. Remember, that would be with our drug guide if we had to look it up.
Okay. So then we might have to just do that.
So,
Since
yeah,
we-
we'll say 30 minutes.
30 minutes.
So long.
So that would be 100 mLs per hour, because then that would give you 50 in 30 minutes.
Gotcha. Okay.
And oh wait, no, that's fine.
Yeah. Okay.
And then, did you do this one? Because it's not infusing.
Are we clamped or unclamped?
You're clamped.
Okay.
That one's
Remember
open.
secondary to unclamp, because if not, it'll keep pulling from the big bag.
Okay, so now it's going down. And that's right.
Okay.
Because this is going at 100 anyway. And that's what this is, 100
Mhm.
So
Yeah,
that
that's
should
gonna
be
run
fine.
it. Yeah,
And
and then
then
it'll
let's
start
keep
pull, then
going.
it'll pull from this one at the rate you originally had.
Right, okay. So yeah.
And that's how these pumps work with that. Okay, so we're gonna go ahead and we're gonna complete our scenario.
Okay.
And I wanted to point out a couple things before we move into our debriefing with the rest of our groups after STEM while we're at the bedside.
Okay.
Okay, so we had our primary fluid hanging and our secondary. how do y'all think y'all did with that?
Okay. I'm just gonna
Okay.
say okay.
Yes.
Okay, so nervous, frustrated?
I think it's
Okay.
more nervous.
More nervous, okay.
Yes.
Comfort with pump, 50-50,
Yeah, could
comfortable
use
with the
some
pump?
work.
Yeah.
Okay. We caught and had resources about how to and where to find if you need to do your secondary infusion rate, so it's not necessarily gonna be on your orders. Some hospitals have the stuff included
Mhm.
from the pharmacy on the sticker, but most of the time that's what you would find in a drug guide or drug resource on how long to infuse it over. Most antibiotics, about 30 minutes. Some can run a little faster, some like vancomycin run a little slower. Then we also had, what else as far as safety checks do we do with this, with our medication administration?
To make sure that, first of all, we had the right patient, right route, that the dose was correct.
It was given at the right time.
Okay.
And then documentation.
And part of the documentation administration is what technology do you use with that?
To scan.
We had the barcode scanner, and we saw you scan the medication. I didn't catch you scan the mannequin.
Mm,
Okay, so remember that's always our backup check. Earlier when you came in, you did identify the patient, you did ask about allergies, you did confirm date of birth. Every time you come in to do a procedure, we want to make sure that we're reinforcing that and just like that culture of safety of, yeah, we may know you're, we know you're Mrs. Haggerty, but we are going to go ahead and confirm all of that so that we make sure that you're safe and we're giving you the right med. Because we just never know that something could be labeled wrong or have the wrong code on it and be the wrong medication. So just the same thing about the drug allergies, just ask them and double check when you come in again.
gotcha.
Okay. But yeah, that was the biggest thing with that I wanted to catch while we were in the room so we could think about it in that environment, and then we can move on to debrief. Is there anything else y'all wanted to discuss?